I'm imagining you've been quite busy the last year. It must have been very intense at WHO. So why was it worth spending the time to look specifically at HIV and COVID?
It's important because this is a vulnerable population, as we know, and we know that, in particularly low middle income settings, the health system is very stretched and overcrowded because of COVID, and we know that the coverage of vaccination is still very low, unfortunately. Although some progress has been made, is still unacceptably low, and therefore we wanted to have a better understanding of who are the vulnerable groups that are more at risk of severe COVID or mortality, particularly in the context of low vaccine coverage. And so that's why it was really important to characterize this risk among people living with HIV.
Okay, and so for somebody who hasn't had a chance to look at the poster, what are the main findings?
So the main findings are that we found that HIV infection was independently associated with severe or critical presentation of COVID-19 among people hospitalized with COVID. And we also found that HIV infection was independently associated with increased risk of mortality among people hospitalized with COVID. And this analysis was adjusted by age, by gender, by comorbidities, and by severity at admission.
Are there any implications in terms of vaccination policy?
Yeah, there are. HIV infection will be included in WHO clinical management guidance for COVID-19. And based on these findings, countries ought to include people living with HIV as a priority group for vaccination.